Hello everyone. I hope you guys have already watched part 1 of it, that is the basic of it, that is definition and classification of dental caries. So now I am moving forward to this specific topic, that is today's topic, that is pit and fissure caries. So this is the part 2. This is the part 2 of dental caries. So let's start then. You can see this is the typical picture of pit and fissure caries. So you can see this, all the pit and fissure of this molar has undergone carious lesion. So these are the pit and fissure caries. So next you can see what it is. So it is limited to, the clinical feature include where it is usually seen. So it is limited to occlusal surface of molars and premolars. So you can see these all are the molars and these are the premolars. So include occlusal surface. These are the occlusal surfaces of the molars and premolars, and buccal pits of the molars. So it is also involve buccal pits. These are these pits which are there, that also get involved, and lingual surfaces of maxillary anterior teeth. Let me zoom it. So you can see it is involving on the lingual surfaces of this anterior teeth. You can see these all are black lesions, whichever you are seeing on the lingual surfaces of this maxillary anterior teeth. These all are also pit and fissure caries only. So next is, these pit and fissure caries are having poor self-cleansing features. So these pit and fissure having poor self-cleansing features. Even after brushing regularly, the food stuck into those pit and fissure is not easily get out from the those pits and fissures, and because of that there is progression of caries is very faster, because it is not a self-cleansable areas. So that's why they have a poor cleansing feature, and usually occur before the smooth surface caries. If the person has poor oral hygiene, then the pit and fissure caries start much more earlier in that patient as compared to smooth surface caries. Reason is same only, because these are the pit and fissure areas, so food lodgement and cleansing become very difficult. They are not self-cleansable site, while the smooth surface is a self-cleansable site. Even we don't do much of the cleansing process of the interior smooth surfaces, still get clean by chewing, eating or any processes. So that's why it is usually occurs before the smooth surface caries in the particular patient. Clinically, how it is look, they look like a black brown in color. So they are black and brown in color, slightly soft in consistency, because there is a demineralization of enamel. And when we do a testing by help of explorer on the surface, then we will catch the tip of the explorer into those pit and fissures. Means our explorer will going to be stuck in those pit and fissures. Adjacent enamel appears bluish white. So adjacent enamel of around that lesion will appear bluish white, and this is also called as an internal caries. Here you can see when we do probing with the help of this explorer, so they will stuck where the lesion is there. They will stuck in those pit and fissure very easily. Next is why we are calling this pit and fissure caries as an internal caries. So reason is that, so you can see this is our caries progression. So you can see the carious lesion is very less on the surface. If someone is viewing from the occlusal surface, we will see only pit and fissure, like a very small just black line is seen on the occlusal surface. But internally you can see this whole area, this whole black area, are you seeing? This whole black area is get involved in it. You can see enamel has involved, even dentine get involved in this lesion. So that means internal caries has progressed very faster, but from the occlusal surface we cannot able to see them. So this is why we are calling it as internal caries. So when we talk about histopathological features, pit and fissure caries spread in a triangular pattern. So what does this mean? You can see this is the triangular pattern. You can see this is the triangular pattern of caries, and they will following the direction of enamel rods with base towards the dentine. So you can see, if you consider it as a triangle, it is a triangular lesion. You can see, and the base, if we talk about this is the base, this is the base, this is toward the DJ or the dentine, and this is our apex. Apex is toward the enamel surface. Apex is toward the enamel surface. So let us see in this schematic presentation. So you can see this is our enamel and this is our dentine. So you can see this blue color triangle has formed. So you can see the base of this triangle is toward the DEJ, apex is toward the surface. So next is when we see a cross section, when we do a cross section, what will we see? The gross appearance of pit and fissure lesion is inverted V with a narrow entrance and a progressively wider area of involvement closer to DEJ. So what it is saying, when we do a cross section of the tooth, what will we see? The gross appearance of pit and fissure caries is inverted V shape. V is like this, so here inverted V shape lesion is seen, and the progressively wider area of involvement of closer to DEJ. So let us see in this picture. So you can see this is our triangle shaped things, this is our normal V shape. You can see this green color line, that it is an inverted V shape lesion. You can see the apex of the triangle is toward the surface or toward the enamel, while the base of this lesion is toward the DEJ. This is our DEJ. So this area is involved in a large amount, means this area, you can see the triangle has widened here, so means here the carious lesion will be more as compared to here. So that's what it is saying, the larger area of a carious lesion is progressed over the DEJ. So we have seen pit and fissure caries in a detail today. So when we talk about treatment, what will be the treatment for it? So the pit and fissure sealant are available. We have to remove all these pit and fissure caries from the occlusal surface, and we seal it with pit and fissure sealant. And if caries has progressed to dentine as well, so what will we do? We will going to prepare a cavity, and then we will restore it with suitable restorative material, that is our amalgam or the composite restoration. So this is the simple treatment.